Let's head back on over now to Mpumalanga, where my colleague Siphephile is standing by with the Premier of the province of Mpumalanga, of course, having greeted the President of the country, Mr. Cyril Ramaphosa, as well as the Health Minister, as well as Basic Education Minister Angie Motshekga, who were all there earlier this morning to check in on the response to COVID-19 in the province. Siphephile, certainly a sentiment that was shared across is that we mustn't give up the fight against the virus.
Good afternoon, Arabile. We're coming to you live from Mpumalanga at Mbombela, one of the hospitals that are designated to take care of people that are suffering from COVID-19, which is Rob Ferreira Hospital. With me here is the Premier of the province, Refilwe Mtshweni-Tsipane, who will explain exactly the 3 pillars that they have in place to fight COVID-19.
Thank you very much for having us. Indeed, we have developed a provincial strategy that has to deal with combating COVID-19. Now, on our strategy, our emphasis is on 3 pillars, which is the primary prevention strategy, the secondary, and the post-COVID-19 aftermath. Now, on the primary prevention strategy, our emphasis is on engagement with our strategic stakeholders, not only at the provincial level, but we want to cascade it even further at the ward level, where we've got priests, we've got chiefs, we've got very prominent leaders that are well acquainted with the communities in which they are leading, that can send the message, because communication is very important and very crucial at this point in time. So what we are saying is that let us form COVID-19 forums within the ward base so that we attack it at wall-to-wall, on a wall-to-wall approach, so that each and every ward we analyze the situation in that ward. How many patients, like for example, if we say in Emalahleni alone we've got 695 patients that are positive, where do we locate those patients? And you might find that out of that 695, it's only 5 wards that are infected. And then we link those areas with the local nearby clinics where they can be attended to, and we encourage our communities to do surveillances and send the message, be their guards for one another, to say that if you've not worn your mask, please let you be cautioned. The second pillar speaks to when the patients are now infected. What is it that we need to do? We have to make sure that we continue with the screening and the testing, and also the isolation of our patients and the treatment. As we do that, we need to make sure that we do provide sufficient facilities for those patients that needs to be treated, and of course the isolation of those presumed suspected cases. Then we try as far possible to take away from their communities, of course with their consent, to say that let's keep them away from their communities so that we avoid reinfection of other members of the family or community members. And lastly, our strategy speaks to what then if people have passed on? Do we have sufficient land to bury them within the municipalities? As a province, we've already procured the bags that needs to be utilized at this point in time, and we're happy with COCTA having looking at working with the municipalities to identify dedicated land for aftermath of COVID-19.
Thank you so much, Premier. That was the Premier of the province in Mpumalanga, Refilwe Mtshweni-Tsipane, explaining what the President uploaded, that the community-based approach, forming forums in communities that will take care of the people that are on the ground and are affected by this disease. And the President said they will replicate it in other provinces. He further said this is the first time this is happening. He also uploaded what Mpumalanga is doing in terms of technology. The government has developed a way in which the tracing could be done through technology. Back to you in studio.